As we said earlier, cancer is not caused by any bacteria, but then some cancers are caused by viruses.
As a doctor, you can suggest the people to move towards these therapies, or the allopathy and the chemotherapy and surgery are the gold standard for the treatment.
There are 4 pillars on which good health is based.
The government or any NGOs or anything that can helpful for them in a cancer treatment.
The problem with government hospitals is that sometimes they will be very crowded. Sometimes you may not get personalized attention.
And what about nowadays? People are asking for the supplements, protein supplements. Yeah, are they have any preventive role?
Protein supplementation may be a good idea. Now in stage 1 and 2, when the organ is, then the cancer is confined to the organ, then any ulcer or any growth over the body which is not healing for a long time, any change in bowel or bladder habits. So all these things, one should suspect cancer. Cervical cancer. Cervical cancer was the commonest cancer in females in India, but then for the past few years, breast cancer has overtaken cervical cancer to become the #1 cancer in females in India. However, now we have different types of treatments available which will reduce the pain or reduce the trouble which the cancer is causing, reduce the volume of the cancer.
Hello. Welcome, sir. So today we have our guest, Dr. Amit Parasnis, sir. He has a 20 plus years of experience in oncology, and today we are busting few myths and what are the recent treatments available in cancer. So welcome, sir, to the Beyond Healthcare Global, our own podcast, which is dedicated for the medical field.
Thank you so much, Dr. Amit.
So basically, sir, the cancer, when you hear the word, everybody get a very high fear about the things. Okay, my personal experience, if you see, my uncle had a cancer. He got a liver cancer, which is a stage 4 cancer, and he lived only for 2-3 months. He underwent a chemotherapy, surgery, and after all the treatments, he died after around 1.5 months. The family completely went through all the phases of his treatment. His daughter, son, my kaki, everybody had all the traumas of his phases when he go for the treatment. So he lost his hair, he got ulcers, and everything he went through, we saw it from our side also and his family also. So basically, I just want to understand about the cancer, why everybody is so feared about the cancer. There is no cure, or what is the chances that the person can live a healthy life even with the cancer, and how the people can face the issue of the cancer?
So let me address all these questions one by one. First of all, one must understand that cancer is not a single disease. Like people have diabetes or hypertension. So cancer is not one particular disease. Cancer always has to be specified. Cancer can happen in any organ in the body. It can happen in blood cells also. And there are different types of cancers which can be differentiated histologically. So there can be different types of cancers in one organ, and different organs can have cancer. So the prognosis, the course of action, the treatment, the presentation of all cancers is different. So you cannot generalize cancer. Why people fear cancer is because cancer cells have the potential to spread throughout the body despite the cancer being treated adequately. So this spread can occur 1 year, 2 years, 3 years, 4 years, maybe even 5-6 years after the treatment is finished. Now this particular ability of cancer cells to spread in the body, go in different organs, cause dysfunction of those organs and cause threat to life is something which people fear. Now does this happen all the time? So not necessarily. When it is going to happen, it depends on the type of cancer, the biology of the cancer cells, the aggressiveness of the cancer cells, and the patient's response to treatment, or the patient's ability to tolerate the treatment also. So not all cancers are bad. Most cancers, especially about solid organ cancers, most of the cancers, if they are diagnosed early, if they are in a limited stage, or the volume of cancer in the body is limited, and if they are treated properly, patient has a good chance of cure. typically we measure cancer survival in 5-year quantums. So we call it as a 5-year survival for different stages. So the 5-year survival, or that is the life expectancy for early stage cancers, is as good as 80%, 90% also. As the cancer progresses, the survival decreases. However, now we have different types of treatments available which will reduce the pain or reduce the trouble which the cancer is causing, reduce the volume of the cancer, and if not cure, we can at least comfort the patient, we can prolong the life of the patient, we can add some months to the life, and maybe we can improve the quality of life also. So all these things are possible. Cancer does not mean, there is a famous saying that cancer is a word, it's not a sentence. Sentence meaning it's not something which you are subject to, like an imprisonment or something. So cancer, of course, it's a bad thing if you get cancer, but the good thing is that you have a lot of treatment options available which work. Okay, so it may not be always like what your uncle had to and his family had to go through. Unfortunately, sometimes cancer gets diagnosed late also. Then we can only try to comfort the patient or try to reduce the suffering. May not be able to cure. But if we go with the right approach, cancer can be like any other disease.
Sir, thank you for elaborating, but there are few myths about the cancer. People always say that my lifestyle, having the high excess sugar, having the stress, for example, I get a cancer. Or sometimes some people say that I smoke a lot or I drink a lot and that's why I get a cancer. And some of my friends, even they are doing the similar kind of thing, but they don't get a cancer. So is it smoking and alcohol and lifestyle or stress has to relate about the cancer?
So this again has two parts. One is about lifestyle and other is about addictions or substance abuse. Now definitely tobacco, alcohol, these substances, abuse of these substances is going to lead to some sort of problems in your body. It can be cancer, it can be cardiovascular diseases, and definitely we can say with certain conviction that people who use tobacco in any form, people who drink excessively, they definitely stand a higher chance for getting cancer. And tobacco or alcohol does not only cause cancer of the GI tract or the oral cavity. There are several organs in the body which are affected by tobacco. So tobacco in any form, smoking or smokeless tobacco is harmful to the body. That goes without saying. So is for alcohol. So excesses of addictions or drug abuse is going to expose you to a higher risk for cancer. Now, as far as lifestyle is concerned, there is something called as a metabolic theory of cancer, that because of high sugar, there is insulin resistance in the body which leads to obesity, and which in some form leads to some damage to the cancer, to the cells of organs, and they may predispose a person to cancer. This is, however, very theoretical. But needless to say, one needs to maintain a healthy lifestyle in order to remain free from diseases, not only like cancer but other diseases also. So lifestyle contributes to your general health, and your addictions definitely are going to harm you.
So few people are saying that even few Ayurveda or homeopathic treatments or some other pathies that can help people to cure the cancer. How much as a doctor you can suggest the people to move towards these therapies, or the allopathy and the chemotherapy and surgery are the gold standard for the treatment?
So we are people of science, and we are people and followers of modern medicine. Now modern medicine believes in something called as evidence-based treatment. Evidence-based treatment means several treatments are studied in patients in series in the form of clinical trials, and several trials have been done over the past so many years in different types of cancers, and trials keep on continuing. So when we say that for a particular cancer the treatment is, say, surgery followed by chemotherapy followed by radiation, so it is backed by solid scientific evidence. Unfortunately, although Ayurveda is an ancient science and I respect it as much as anyone else, Ayurvedic drugs have not been extensively tested, or Ayurvedic, I would say, lifestyle modification or any herbs or any dietary supplements have not been tested or studied in clinical trial format. So they are not backed by scientific evidence. So recently there was a video which was circulating about a past cricketer's wife being diagnosed with
we
cancer,
just heard about
and
this,
yeah,
yes.
and then she they claimed that she was cured because of her dietary modifications and some. So it is a myth that Ayurvedic dietary supplements or homeopathic dietary supplements or any additives will cure cancer. Cancer scientifically can be controlled or cured only with standard modern medicine treatments. Yes, these supplements will improve your quality of life. Maybe they will at times improve your tolerance to the chemotherapy or whatever treatment is being given. Maybe they will slightly alleviate the symptoms. So that can happen. They can be used as adjuncts, not as the main treatment. So right now, as far as evidence is concerned, the treatment of cancer should be done by modern medicine methods, and it can be supplemented with lifestyle changes and dietary supplements, so on and so forth.
So basically the lifestyle has to be changed. The main treatment is always allopathy, and the treatment and other medicines and Ayurveda are supplementary to maintain your life.
Correct.
That is the crux of all the stories. Second important thing, I just heard about that fasting prolong that decreases the risk of cancer in future. Is it true?
So again, all these things, videos which you hear, which you see on social media, they are not backed by evidence.
Yeah, got it.
So although intermittent fasting can be a very good method of losing weight or maintaining your health, I don't think it has got anything to do with cancer. So if a person says that I am doing intermittent fasting and on the other hand he is smoking some 10 cigarettes per day, so obviously he is going to have a greater risk for cancer.
So basically you have to reduce the risk of the lifestyle problem that decreases the cancer rather than the going through the fasting and all the life.
So what I would like to send a message across to general population is that any type of this fad or fanatical behavior as far as your diet or your exercise or your lifestyle is concerned is not going to help you. There has to be a balance. There has to be a balance in your diet, your exercise, your sleep, your emotional health, the way you go across with your daily activities. There has to be a balance. So eating something and not eating anything else may prove harmful, or eating one thing in excess is going to prove harmful. Needless to say, any type of addictions and drug abuse is definitely going to be harmful. So all these things go together, and there is no 100% formula like you do this, you don't do this, and then you will not get cancer. You cannot say that such a formula exists with any conviction.
So few myths just to ask you. One is microwave or air fryer, whatever we use, that do lead to triggering the cancer in a people?
There is no evidence
No
to suggest
evidence
that.
about that. Secondly, one more important thing I have to ask: every cancer patient, when they undergo treatment, chemotherapy, they always have to lose their hair, or they have to suffer with the ulcers and other issues of their health. Is it every patient has to go, or it depend on a patient to patient?
So that's a very good question. So we should start by enumerating the modern ways to treat cancer. So for solid organ cancers, the treatment would be divided into surgery, chemotherapy and radiotherapy. There can be other supplementary treatments like targeted therapy or immunotherapy also. But let us talk about surgery, chemotherapy and radiotherapy. So in the past, a cancer, if it affects an organ, we would have needed to remove the entire organ. Sometimes now we are able to salvage or do an organ conservation surgery, like say for breast cancer. Previously the treatment was removal of cancer. Now in certain cases or most cases of breast cancer, we are able to save the breast, thereby giving a good cosmesis to the patient. So there are surgical developments and surgical advances which are there. About chemotherapy, now chemotherapy is something which can be loosely called as anti-cancer injections. So anti-cancer injections, they act by, they are given intravenously through the blood, through saline, and they act by reaching all the organs, all the tissues in the body, and the drug acts on cancer cells wherever they are placed in the body. So like they might be dormant in the liver, or maybe in the lungs, or maybe in the nodes, lymph nodes. The cell will act. The property of chemotherapy drugs is that it will act on dividing cells. Now cancer cells are dividing cells. But then there are other cells in the body which are dividing, like hair, the gastrointestinal mucosa. And sometimes what happens is, as a side effect, when cancer cells are killed, these cells are also killed because they are dividing cells.
So that's
And
why
that is
they
why you get the side effects.
Oh, yeah, okay. And these are the most common side effects.
Correct. So hair loss, decrease in immunity, then some loose motions or ulcerations. These are the side effects. But then you now have modern drugs which will cause less side effects and which will also reduce the side effects to a large extent. So we do have drugs which will reduce the hair loss. There are some scalp cooling techniques which can be done during chemotherapy, which will reduce the hair loss. So those techniques are available. And again, it's a very small price to pay. The chemotherapy in the correct fashion is going to actually help you cure cancer. So a few months of side effects and a few months of hair loss is a small price to pay. Although you need not bear it, there are methods to avoid hair loss and there are methods to reduce the side effects. So that can be definitely taken care of. Radiotherapy, again, it's a very interesting branch of cancer treatment. As you all know, radiation, uncontrolled radiation, will cause cancer.
Oh, yes,
like it has happened in Hiroshima, Nagasaki, or any nuclear accidents. And controlled radiation, which is given with the help of a radiation machine, controlled radiation to a particular cancer will actually cure or destroy that cancer. So that is the property which we use when we treat a patient of cancer with radiation. So unfortunately, again, when a cancer is targeted, some part of the normal organ around it also gets radiation, and then again you will have some side effects because of that. But now we have modern radiation machines which will try to target only the organ and spare the remaining area surrounding the organ, so that the side effects are reduced and the radiation is delivered accurately.
Okay. Sir, it is always says that cancer come without sign. So is it always a true, or sometimes you can get a signs before cancer?
That's a good question. It can happen that a cancer can develop in the body and not cause any signs or symptoms for some time. That is because sometimes you have a cancer developing in the food pipe or in the esophagus. The food pipe is a pipe-like structure. It is designed to be collapsible and expandable. So as the food goes, it expands, and when the food has to be propelled down, it contracts. So until and unless around 50% of that the area of the food pipe gets obstructed, patient will not have symptoms. And sometimes by some other for some other reason, if the patient gets investigated, the cancer may be diagnosed, or sometimes the patient may have early symptoms and some investigations are done and the cancer may get diagnosed. But by and large, the reserve of the body is so much that sometimes there may not be symptoms, and that is the whole crux, that any symptoms which you have which are not subsiding by normal treatment for 15 days to 1 month, they need to be investigated. So you are going to a family doctor for some trouble. Your family doctor gives you medicines, your trouble subsides in the next 8 days, fine, it's gone. But any sort of a trouble, any non-healing ulcer, any lump in the body, any trouble which is not going, any change in voice, any weight loss, unplanned weight loss, any bleeding from anywhere, which is not subsiding by normal treatment, needs to be investigated. And by investigations, I mean like something like ultrasonography or a scopy or a scan, which will help you suspect the presence of cancer. That does not mean that cancer is always there. What I am trying to say is anything should not be left for long.
Sir, one more thing is that big pollution and mobile radiations, they do have a play in a cancer in nowadays population, what we see.
So there is something called as background radiation, which is because of the sunlight which we get and because of the elements in the earth. So that is unavoidable, everyone gets that. The mobile radiation is also something which is there are even different forms of other electromagnetic waves around. So there is no evidence that they will cause cancer per se. And pollution, I think it will cause a lot of respiratory illnesses, especially if you are talking about air pollution. A lot of respiratory illnesses are caused by air pollution, and chronic inflammation, that is chronically inflamed organs. This particular state is in some way responsible for cancer. because cancer is basically a transformation of normal cells. Now when there is inflammation, these normals and the inflammation does not subside immediately or remains for a long time, there can be something which goes wrong and the cells can get transformed into cancer cells. So someone puts tobacco in the mouth, there is an ulcer, and the ulcer does not heal, the ulcer grows bigger, and then at some point cancer can develop. So similarly, pollution in some form which will lead to infection or inflammation may predispose to cancer. We can have lots of other types of pollutions like food and water pollutions. There is definitely a harmful effect of water pollution and food pollution, but we cannot pinpoint it to development of cancer.
Sir, are there in India belts, regions of the India which are more prone for a cancer? Is it because of the demography, or is it because of the pollution or things there, or is it because of the genetics of the people which plays a role to susceptible for cancer?
So there are some areas. One particular area can be discussed, which is the Gangetic Belt, which is from Uttar Pradesh to Bihar to West Bengal. Yeah. So it has been found that there is a large amount of gallbladder disease and gallbladder cancer or hepatobiliary pancreatic cancer in that area, and that can be said to be attributed to the high amount of selenium content of the water in Ganga. So that is one thing. Apart from that, some particular cancers are attributed to particular dietary customs or habits, like tobacco can be seen anywhere, like smoking can be seen in different places. So then there was something called as Khangri cancer with the Kashmiris who used to use warming belts.
Yeah.
So these are particular, not genetically linked, but they are like practices or customs which may predispose a particular area, people living in a particular area, to cancer. But by and large, cancer is a very common disease now. It is said that around 212 males per lakh males and around 186 females per lakh females have cancer.
Oh, it is huge.
Yes. So 2.2 crores of cancer cases all over the world in 2020, which is expected to rise to around 3.5 crores by the end of 2050. Yes, it's growing. Because population is growing.
Yeah, and longevity
is growing. People have means of diagnosis of cancer. Awareness is growing. So cancer, the number of patients with cancer is going to grow.
So which is the most common cancer actually we see in India or our part of the region?
So if you look at males, the commonest cancer is lung cancer, and the second most common, which is a very difficult health situation in India, is oral cavity cancers. Apart from that, colorectal cancers are also common. In females, there is an interesting thing. For a long period of time, cervical cancer was the commonest cancer in females in India, but then for the past few years, breast cancer has overtaken cervical cancer to become the number one cancer in females in India.
So is it because of diagnosis become clear, or is it because of the change in the demography of the cancer?
It is because of changes in lifestyle, because breast cancer is predominantly a disease of the urban areas, and as urbanization grows in India, the urban lifestyle, the diet, the stress, everything grows, and there is some hormonal influence to breast cancer, and that's why the pattern is shifting from other cancers to breast cancer.
Sir, however, few females says that, and we heard about the things that using a bras can lead to the breast cancer. Is it true or?
Absolutely not. So it's got nothing to do with the color of your bra or how tight or how loose the undergarment is.
Because it is commonly we heard.
Yeah, so that is absolutely just some nonsense which is spread on social media. There's no grain of truth to it.
Sir, now I have to understand about the treatment of the cancer. So basically, as I am a doctor, as we know that we have to diagnose first the cancer. Is it a cancer or not? Then we have to treat the cancer. There are n number of therapies. You know that there are surgeries, chemotherapy, immunotherapy, genetic therapy. Recently, new advances come about the gene therapy of the cancer. Some are talking about nanotechnology. Some are talking about the AI in a cancer. So can you just elaborate about this to us?
So this is a very huge question with so many connotations to it.
2 minutes.
So let us come first about diagnosis of cancer. Now, as we said earlier, that the common signs of any cancer anywhere in the body would be a lump which is newly developed. This may be cancer, it's not like 100% sure. Any bleeding from any orifice in the body, again it may be cancer, not 100% sure. Significant weight loss without intentionally losing weight, change in voice, then any ulcer or any growth over the body which is not healing for a long time, any change in bowel or bladder habits. So all these things one should suspect cancer. That does not mean that this is 100% cancer. This should raise suspicion for cancer. The problem with cancer is that people do ask me a lot of times, ki, you tell us a test, we'll get ourselves tested whether it is cancer or not. So this can't be done because cancer is not one illness. It can affect any organ, and there can be different types of cancers which can be seen in the same organ. So particular signs or symptoms which will lead us to suspect development of a tumor or cancer in that particular organ. So depending on that, we will have to do the investigations. So for example, a patient comes with a breast lump, we would, if she is above 40, we would do a mammography, which is like an X-ray of the breast, and then if it's suspicious, we would do a needle biopsy. So biopsy, again there is a myth which we forgot to address. Some people have a misconception that biopsy will lead to spread of cancer. It does not.
I heard about that.
Yeah, it does not do that. Biopsy is essential for obtaining a diagnosis of cancer. It will also give us some characteristics of the tumor which will help us in planning treatment. So biopsy is of utmost importance in cancer. So biopsy can be done superficially, like in breast, or suppose there is a skin lesion that can be biopsied. Something which is inside the body, like in the esophagus or stomach or in the colorectal region, will need to be biopsied via scope. So upper gastrointestinal scopy or lower colonoscopy will need to be done whenever that type of cancer is suspected. For ladies with bleeding, internal examination and a biopsy can be done. So these are the different methods of biopsy, and there are again methods of imaging a cancer, imaging an area of the body, that is with the help of CT scan or an MRI. There is another method of doing a scan for cancer that is called as PET scan. So it's positron emission tomography CT scan, which will target the dividing cells of the body. So a particular glucose isotope is given, which is taken up by dividing cells, and dividing cells means cancer. So a PET scan will tell us whether the cancer has spread anywhere else in the body. So a diagnosis of cancer.
One question,
yes.
Sir. If somebody want to do a PET scan independent of diagnosis of the cancer, can he do a PET scan and to understand if he has a cancer?
So PET scan, to know whether you have cancer or not is not justified. There are different non-oncological uses of PET scan. Sometimes a fever of unknown origin, a PET scan can be done, or some infection has to be diagnosed, PET scan can be done. But a person can't go to a doctor and say, I want to do a PET scan, whether I want to know whether I have cancer or not. That is not actually advised and not very wise thing to do. So these all investigations will diagnose the cancer and it will stage the cancer. Now, as we said earlier, cancer is divided into different stages, stages 1, 2, 3, 4. These are common staging paradigm for solid organ cancers. So solid organ cancers, I mean breast cancer, esophageal cancer, thyroid cancer, gastrointestinal cancer, stomach cancer, cervical cancer, ovarian cancer. In stages 1 and 2, the disease is limited to the organ and some regional lymph nodes. And in stage 3, the disease is locally advanced generally, and in stage 4, the disease has spread from that organ of origin to different organs in the body. So this is true for the staging of solid organ cancers. Now in stage 1 and 2, when the cancer is confined to the organ, surgery comes into play. So oncosurgery, which is cancer surgery, comes into play. You need to have a different kind of training for understanding this classification, understanding the behavior of cancer, and doing the surgery also. Because cancer surgery, although it's a surgery, one needs to undergo training to do that radical type of surgery. What surgery needs to be done, what organs can be preserved, and what need to be removed needs to be understood. So a surgeon has to undergo extra training to get trained in cancer surgery. So like I said previously, we used to remove the entire organ. Now it is true for, especially for breast cancer, that you can conserve the organ. But then essentially removal of organ or removal of part of the organ and restoration of function is what cancer surgery means. And along with the organ, we remove the surrounding lymph nodes and whatever area which needs to be removed. So for example, in oral cancer, we remove a part of the, say, if it's tongue cancer, we need to remove the part of the tongue. If it's close to the bone or involving the bone, we remove the bone. If it's involving skin, the skin is removed. And then different types of plastic surgery flaps are used to reconstruct so that there is adequate cosmesis and function. So this entirely constitutes cancer surgery. You cannot just remove an organ and just leave it that way. You have to restore the function.
Like few politicians had the operation.
Correct.
Yes.
So a lot of celebrities also, they are like human beings, so they are also going to have cancer, or they may have any other illnesses also. So surgery essentially means removal of cancer with surrounding tissues. So again, cancer, when you remove cancer, you don't only remove the cancer, you remove it with margins, good margins. So the margins have to be free of, they are microscopically examined by the pathologist, and the margins have to be free of cancer. Then you can call it as a correct cancer surgery. So removal of organ with margins, wide margins, and restoration of function and cosmesis to whatever extent possible is what is cancer surgery. Now cancer surgery can be done by open method. Suppose you are talking about internal organs, it can be done by open method, which is traditional. It can also be done in many cases by minimal access techniques, that is laparoscopy, or there are advances in laparoscopy like 3D laparoscopy, or again now you have a different technique which is robotic surgery, in which robotic arms are placed inside the abdomen or in the thoracic cavity, and the surgeon will be able to perform the surgery remotely from a console, and when he moves his hands on the console, the robot operates inside. So robotic surgery does not mean that the robot is operating on you. It is of course you know that, and this is for the lay public. So the robot will actually follow the orders or the actions of the surgeon. So surgeon is operating with the help of a robot. So it is better called as robotic assisted surgery rather than robotic surgery. So these all techniques are available here in our city.
There is a difference between the robotic surgeries or what the other minimalistic pinhole surgeries you do. So is there a difference in outcome of the surgeries?
So as we said, the outcome is measured in the form of clinical trials. So we can safely say that in most places, the outcome of robotic surgeries and minimal access surgeries is similar. So there is no reduced or oncologically unsafe outcome. It's not there now. So we see, the thing is, the surgery remains the same. Now open technique, laparoscopic technique or robotic technique are means of accessing the organ. So as long as the surgeon knows what needs to be done and he does it with proper care. So if I am a surgeon, I am operating through laparoscopy, and if I feel that this surgery is not getting properly done by laparoscopy, it is my duty to open it and then do it properly, because removal of the cancer is going to have an impact, or proper removal is going to have an impact on the life of the patient. The access, whether there is a scar or whether there are 4 small scars, is not going to have an impact on the life of the patient.
So you said the 5-year survival.
Correct. So as a cancer surgeon, it's my duty to remove the cancer properly. Now I can use different methods for it. If the patient is selected right, the tumor is small and it is easy for me to operate by minimal access or by robotic, it's fine. At any point, if I feel that I am not going to do justice to the patient, I will need to convert it to open. So when you do this surgery, we always do a detailed counseling of the patient. We take a consent that what all things we are doing, and if needed, we may need to convert to open. And patients usually understand all this and they give consent. So, but surgeries like say esophagus now, or say surgery for endometrial cancer can be safely done by laparoscopic methods. Again, when the cancer is small, the volume is small, it has not spread, the surgery through minimal access techniques or robotic techniques is easier to do. So that is about as far as surgery is concerned. Of course, there is a surgical recovery also. And then we come to the chemotherapy part, so which we have discussed earlier, that there are several drugs available, several options available. Chemotherapy drugs need to be taken in cycles. and the cycles may be, there is a duration of 1 week, 2 weeks or 3 weeks in between cycles. So this is how chemotherapy goes. Again, a doctor needs to be trained in administering chemotherapy, because it's not just administration, it is knowing which drug to give when, how to monitor the side effects, and how to change drugs if required. So it's a special training again after your graduation. So specialized treatment needs specialized education, isn't it? And again, coming to radiation, radiotherapy is again a specialty, cancer specialty in itself, and there are radiation machines. Now, setting up a radiation machine is a big proposition. There are several guidelines laid down by the Department of Atomic Energy, and it is also regulated very stringently by the Atomic Energy Department, because there is the radiation source which is involved. And there are several different radiation machines, newer generation radiation machines, which deliver the radiation accurately to the organ required. So, when a solid organ is treated in early stages, the sequence may be surgery, chemotherapy, radiation, or it may be chemotherapy, surgery and radiation, or it may be radiation followed by surgery. It depends on the tumor location, tumor type, and the volume of the tumor. So your cancer treating people, the team will take a joint decision as to what the sequence of the treatment would be.
So it is actually teamwork.
Yes, it is a teamwork. It is discussed in something which is called as a tumor board or a joint clinic, and several people are given an opportunity to discuss the pros and cons of each treatment, which is the best treatment that is selected by a joint decision, and then the patient would be told about the decision, and then the treatment would be started. So all this is how it goes for a particular cancer. So we are talking about early cancers. When cancer advances or when it metastasizes, stage 4, there is very little role of surgery in it. Mostly there is almost a very palliative role, or if there is some bleeding or obstruction, then only we need to operate. Otherwise, the treatment is done by mostly with palliative intent, with the help of chemotherapy or radiation, or some palliative therapy in the form of symptomatic treatment also. Again, there are specialists called as palliative care physicians who specialize in this branch of palliative care. Then they would be doing extensive counseling of the family, of the patient, and they would be trained in giving end-of-life support to the patient. They will be trained in counseling the patient's family about the situation which is going to arise in the near future, the unpleasant outcomes. So all these things, there are special people, and they are trained to counsel the family well. So all these things have their place in the treatment of cancer. So it's not a single person, teamwork is involved, right from diagnosis to treatment. A lot of people are involved in managing your cancer.
So can you just touch and go for the immunotherapy and gene therapy?
Yeah. So again, as we know, cancer is not an infection. It is not something which is caused by bacteria. Now there are some cancers which are caused by virus. We'll come to that afterwards. But by and large, cancer is just uncontrolled growth of cells of your own body tissues. So what happens is, like we said, chemotherapy is going to kill all dividing cells. Now, since a tumor is your own body cells, ultimately what kills cells when you have an infection, what kills cells is your own WBCs, is your own white blood cells. Your own immunity works against them. But since cancer cells are the body's own cells, immunity does not act against them. So there can be various forms of immunotherapy which will modify your immunity or the patient's immunity in order to make the body's own immune system work against the cancer. So this is called as immunotherapy. So one way of acting it is removing some checkpoint inhibitors. So there are innate checkpoints in body's immunity which will not allow it to express in a large amount. So when those checkpoints are removed, the body's own immune system is able to express in a larger way and target the cancer cells.
And kill the cancer cells.
Correct. So that is one point. Then another point will be modification of your own T cells. T cells are something which work against cells. So modification of cells, T cells, by doing some genetic modifications in them, and then reintroducing them in the body so that they will go and work against the cancer cells. This is something called as CAR T cell therapy, which is mostly useful in some types of blood cancers. And again, there might be some gene editing which can be done. Some certain type of RNA can be introduced, which acts against the DNA of the tumor cells. So all these things can be used, out of which immune checkpoint inhibitors are already being used. They are quite, they are not so costly. Of course, they are costly to a certain community, but they are very commonly used now. So all these therapies are used in advanced cancers, mostly in blood cancers, maybe in lung cancers, myeloma sometimes. These things are there. And then sometimes these things work miraculously. Another thing is that we said earlier that chemotherapy will act against all dividing cells, all cancer cells. So there is something called as targeted therapy, which means that there are certain receptors on the cancer cells which can be identified. And there can be some monoclonal antibodies or some drugs which can be produced for working against those receptors. So when such drugs are given, these drugs will act only on the cells which carry those receptors, which are cancer cells. So then they will cause less side effects. So that is the idea behind targeted therapy. So that also has its uses in different types of cancer. Different targets, molecular targets are identified and antibodies have been prepared against them. Okay. So it's there already.
Sir, this is the era of actually technology, and we are always talking about the robotics and AI. So is there anything which nanorobots or nanotechnology and AI under research or people are actually working on or doing to treat the cancer?
So AI has a large role to play in diagnosis of cancers, because AI can identify patterns and images can be analyzed in a certain way which a human being cannot do. Like say 1,000 images can be analyzed. Say an AI algorithm would be given say 1,000 images of cancer patients, and it will be able to identify patterns and nuances in those images which a human eye would not be able to do. So AI has got a very potentially large use in diagnosis of cancers as far as radiology and pathology goes. And then there are again a lot of drug delivery systems which can be controlled by nanotechnology. Some diagnostic techniques like capsule endoscopy, wherein a small capsule is introduced in the GI tract, and it can go in places where the normal scope can't go, and it can send back images to the console, and then you can see parts of the small intestine which you would otherwise not be able to see. So all these technologies are there in infancy still, but yes, it can be a thing of regular use in the next 10 to 20 years.
Yes, so there is a promising future ahead.
Definitely. So technology, as it grows, the applications of technology are going to grow. And we, in modern medicine or in modern surgery, we use technology a lot.
Yes.
So it is going to find uses in our regular practice also.
So one more thing is I want to ask about recent few years we are coming up with the gene mapping and genetic screening, so that we can identify a future, how much probability you can get a cancer. For example, we heard about the famous celebrity who underwent a mastectomy, which is a preventive for her because she diagnosed with the breast cancer gene. Correct. So are these things are actually helpful or true, or is there anything which you can put a light on?
Yeah, this is a very good question. So let us understand that all cancers happen because there is some genetic abnormality in the cell. So cell which has a certain lifespan, it continues to live beyond that lifespan and continues to divide and grow because of some genetic abnormality. So a cell which is supposed to die does not die and continues to live. Now, why this genetic abnormality occurs? It can be because of toxins, it can be because of radiation, it can be because of unknown factors, and it can be because of hereditary factors. So there can be certain genetic abnormalities which can be transmitted genetically, and they will cause the formation of cancer, and these have been identified. So BRCA or BRCA1 and 2 are such genes which predispose a family of ladies in a family to breast cancer and to ovarian cancer. So these are, and again there are some other such syndromes also, like Lynch syndrome for colonic cancer. There are other such syndromes also have been identified, and the genetic abnormalities associated with these particular cancers or abnormalities have been identified. So when there is a whole different branch of medicine called as genetics, and such particular cancers, they tend to run in families, like mother, sister, aunt, all have cancer, different types of cancer. There can be certain cancers in the males of those families also, and then certain genes have been identified, and then this particular information can be used to prevent cancers in the next generation. Now we are talking about something like prophylactic surgery in an organ which potentially has a large chance to develop cancer. So typically, suppose a patient develops breast cancer or ovarian cancer in young age, we tend to advise them to undergo genetic testing, because if they are having some genetic mutation, one is that they can benefit with some special drugs which can be used in the treatment, and two is that the future generation can be tested for the same mutation, and then they can decide to undergo prophylactic surgery or not.
So it is a preventive treatment.
It is a preventive treatment. So for typically an example is that a woman of say 35 has breast cancer, and if you find her to have a BRCA gene positive, so you may advise her to undergo a prophylactic bilateral mastectomy, because she has a 95% chance of getting breast cancer.
Can her sister or her cousin do screen for the
Correct.
same?
So her sister needs to be tested for the same gene, for the same genetic mutation, and if it's positive, then she will also be given that option. Such people are also given an option of removal of ovaries after a certain age, so that because removal of ovaries will cause menopause, so after 40, 45, after completion of families, they may be given an option of prophylactic removal of ovaries also, because there is 65% chance of developing cancer in the ovary. So genetic testing will help us treat the particular individual properly also, and the non-affected individuals in the family also.
So one more thing, nowadays we see that more younger people getting a cancer. The trend has been showing us, and still they have not started the family. So what is the future for their reproductive health if the patient is diagnosed with the cancer?
This is a question from a gynecological point of view. I can understand that. So there are two types. We can divide this into these things. One is the cancer actually of the gynecological organs, and cancer of other organs. Say for example, in males, you can have testicular cancer. Now, in such cases, patient needs to undergo chemotherapy. Patient needs to undergo removal of testes, and this is typically a cancer of young people whose family may not have been started yet. So then they have an option of doing sperm preservation, semen preservation, and for ovary or for females who have say like breast cancer early, they have an option of doing ovum freezing or ovarian tissue freezing. Sometimes you have cancer of the ovary, germ cell tumor of the ovary in young ladies. In those cases, you can again you will have to counsel the family, and then you can do a ovarian tissue preservation or a oocyte preservation in some way. Typically, chemotherapy will cause permanent loss of ovarian function in around 25% of cases. So the family also should be made aware about that. Unfortunately, you get sometimes a cancer of the endometrium or cancer of the ovary while the lady is being treated for infertility also. Now, unfortunately, in those cases, then probably surrogacy or adoption would be the only answer. So fertility in oncology is a big thing, especially as you rightly said that the age of cancer is reducing, or we have a lot of cancers in younger population also. So those things also need to be taken care of before starting any therapy which will affect future fertility. So the oncologist has to be aware that this is an important fact which needs to be taken into consideration.
So there is a future for a reproductive health of the patient who diagnosed with the cancer in early age.
Yes. Suppose a patient has breast cancer in early age, some sort of a oocyte preservation or ovarian tissue preservation can be done, so that the patient, when she gets cured of cancer and if she desires to have fertility, she may be able to do so.
Sir, about now we talked about the cancer myths, its treatment, its preventive part little bit, which is the surgical part. I just want to understand what we can do as me as a doctor also, as a young person also, so that I can prevent having a cancer through my diet, lifestyle, or do I have need to do for any supplementation to prevent myself from the cancer?
This is a very broad-based question. I can answer from my general knowledge and from my experience in medicine also. There are 4 pillars on which good health is based. One is your diet, other is exercise, third one is sleep, and fourth one is your emotional health. So diet, as we know, if we talk about diet, it can be endless. It can be a topic of several podcasts. But in a balanced diet, which contains enough nutrients, should be good enough to maintain good health. Any type of excesses should be avoided. Excess of any sort or deficiency of any sort should be avoided. So I would say by and large our basic Indian staple diet, which consists of vegetables, pulses, carbohydrates, food grains, should be a good diet for any person to follow. There can be some degree of modification of diet as you grow old. So the type of diet and the volume of diet which you take when you're a younger person, it needs to change as you grow older, because your ability to digest that diet, your ability to benefit from the diet also changes as you grow old. So that much modification a person would be able to do by himself or herself. So a balanced diet is very important. Avoidance of any substance abuse or drug abuse or any excess of any sort needs to be taken care of.
So balanced diet means the junk food part of the diet. What about you can have to say about this?
That's a good thing which you suggested. It is understood now that processed foods contain a lot of substances which are toxic to the body. They can be the cause of not only cancer but also cardiovascular disease and diabetes.
Can you say a few?
Hypertension. So this processed meats basically, processed meats, processed food, any type of food which has been processed and stored or which needs preservation for a longer time. A lot of chemicals go into the food, and then those chemicals are going to cause problems with your body's systems. So those have to be kept at a minimum, and all these processed foods are found in your so-called junk foods, which have a bigger shelf life. So any food which is fresh, which is minimally processed, which comes directly from the plant to you or from the farmer to you, that's the best food to have. So avoidance of junk food diets, avoidance of any diets which are not natural for your body. This goes a long way in preventing any kind of disease, not only cancer.
Sir, what about they called as the A2 ghee and the organic food? What do you have to say about this?
So it is good that you are aware of all these things. One is aware of all these things, but then you cannot pinpoint that taking this now. Suppose you say that I am taking A2 milk or I am using only organic products, and then I will never have cancer. You cannot say that. Also, with due respect, we don't even know how accurate these claims are about organic foods, because we are not going to go there and examine where the food is coming from. So we have to take it with a pinch of salt. If you feel that is going to benefit you, if you're able to afford that, suppose it might be costly, if you're able to afford that, there's no harm in taking a particular type of milk or using a particular type of food, as long as it is not a processed food. So processed food by and large should be avoided or minimized as much as possible. Whether it's organic or not, whether it's a specific type of milk or not, will not make any difference.
And what about nowadays people are asking for the supplements, protein supplements? Are they have any preventive role or anything?
So the thing is, it's not specific to cancer, but what the situation is that typical Indian food is deficient in proteins. Because the only way a vegetarian person can have proteins is through pulses and maybe milk proteins in the form of paneer or milk products. So protein supplementation may be a good idea, but it's not that it's absolutely essential. a person can have adequate dietary intake of proteins through normal food also, and if he or she is unable to take that much protein, which is around 30 to 40 grams per body weight, per kilogram body weight, that much is the protein which is required. So if you are unable to have 40 to 50 grams of proteins every day, then a protein supplementation would be essential. But that does not mean to say that it is going to prevent cancer or in any way. But then proteins are required; they are the building blocks of the body. And if the dietary requirement is not satisfied, it may have a harmful effect. So protein needs to be there in the diet, adequate amount. It can be in the form of dietary modification or supplements.
And vitamins?
Same goes for vitamins.
Okay.
It is a known fact that vitamin B12 is deficient. People who are vegetarians, you may have deficiency of vitamin B12. But by and large, if you maintain a balanced diet, and after a certain age, some vitamin supplementations, vitamin C, vitamin B12, vitamin A, vitamin D, they can be used as per the suggestion of your physician. They will be useful for maintaining general health, not specific to cancer.
But just it improves the immune status and the strong.
Definitely, it will improve the status of your mucosa, it will improve the status of your bones, and it will give you a feeling of good health. And definitely, as your diet modifies when you grow older, most people will require some supplementation of vitamin D, calcium, and some basic vitamins also.
So you are looking so young even at this age. So
I'm not very old.
you are young at this time also. So basically, one more thing: are there any vaccines or any preventive medicines available to prevent for the cancer?
So, as we said earlier, cancer is not caused by any bacteria, but then some cancers are caused by viruses. So, as you know, as a gynecologist, that cervical cancer is a cancer which is by and large caused by infection due to human papilloma virus. So, human papilloma virus, a woman is exposed to whenever her sexual activity starts, and if a HPV vaccine, human papilloma virus vaccine, is given before the sexual activity starts, and of course there is regular checkup and regular pap smears throughout the lifespan of the person, then we would be able to prevent cervical cancer to almost the tune of 90 to 95%. So human papilloma virus vaccines are the only vaccines which can be said to be preventive vaccines against cancer, and that is only for cervical cancer.
Not for penile cancer?
It is actually ideally to be given to males also before starting the sexual activity. So both, because the infection would come from a male also. So that only for this particular cancer or this particular infection, we can say that this cancer vaccine will be useful.
What about hepatitis B vaccine?
So hepatitis B infection is transmitted typically through sexual contact and through a transfusion of contaminated blood products. And hepatitis B is known to be a causative agent for liver cancer. Yes. So most medical personnel have to mandatorily undergo hepatitis B vaccination as a part of their employment or wherever they are working, and it is a good vaccine to have. I think it's incorporated in our vaccine schedule also. You cannot typically call it as a cancer vaccine, but it does have a role to play, because if you prevent hepatitis B, in some way you are avoiding hepatic cancer.
Sir, actually cancer treatment is a cost bearing treatment, and it is as an Indian, the most of population is poverty line or near middle class. So how the person and get help from the government or any NGOs or anything that can helpful for them in a cancer treatment?
So healthcare is an issue in most countries, because government sponsored healthcare is a costly thing for the government, and for a country like ours which has 140 crore plus population, it is very difficult to maintain or very difficult to introduce a health scheme, although government has been giving its best effort to that. As a person, I think in India we are fortunate, and in Maharashtra especially, we are fortunate to have access to government hospitals which are mostly well equipped. The problem with government hospitals is that sometimes they will be very crowded, sometimes we may not get personalized attention. We are now seeing in different hospitals, and when we treat patients, that around 60-70% of our patients do have either personal insurance, health insurance, or they are covered by some form of employment insurance. So having an insurance as an educated person, as a enlightened person, having a family health insurance is very important, because it will protect you against unforeseen circumstances. There are government schemes which will cover cancer treatment also, although they might be difficult to access to all, and sometimes you may not be able to cope up with the type of volume. The government itself cannot be cope up with the volume which it encounters. So definitely having a personal insurance or a employment based health insurance helps. And of course, doctors in most hospitals, they have something called as either a inpatient, indigent patient fund, or some sort of concessions, or some sort of a charity based help to the patients. And since a patient is not only one patient, it's an entire family, a lot of help is extended by most hospitals to these patients by various means possible. There are several nodal agencies. There is something called as the CM Relief Fund or the PM Relief Fund, and there are a lot of charitable institutions which give monetary help to these patients. So the most cancer treatment institutions would be aware of all these things, and they would guide the patient accordingly, and they would try to help the patient. They will try to make the treatment easier and affordable to the patient in some form.
So thank you, Amit sir, for coming and helping us and giving a broad view on the cancer, from the prevention to the treatment. So guys, we are waiting for next podcast. Thank you, Dr. Amit. Yes.
Thank you.